take a step here. I forgot to hit record. This is why I need my person with me. So doulas are powerful educators and encouragers of advocating for oneself in the birth space. So sometimes a client might be afraid to speak up, and I know that you as a doula, you're already backing them up, but this is another place to do that, just at another level. So if an expectant parent feels like something is off, support them, encourage them, and make sure that their doctor listens to them. And so, again, that's Kai Dalton's story. And we're here today to talk about how you can, as a doula, educate and empower the expectant parents that you work with. So, what is Count the Kicks? Count the Kicks is an evidence-based program that is designed to help expectant parents get their baby here safely. This serves as an early warning system for anything that could be wrong in the third trimester, and empowers parents to speak up if they notice a change. So we have a mobile app, we have web counters, and we have paper counting charts. We know our program can be effective with over 130 babies saved in 5 different countries. And so that's really important to think about the benefits to the expectant parent that comes with Count the Kicks. So this could be anything from a heads up on a preterm labor or a hemorrhage or a genetic condition or preeclampsia. It's really important to know that the doula can give this tool out to make sure that their clients find value in what we're asking them, the client, to do. So learning about Count the Kicks and using this, and again, I've seen people who use Count the Kicks and it works. Sometimes people are not, they think that this is one more thing that they have to talk about, especially, in the community health line of work where we have so many resources. But our clients are up against so much. And so it's really important to think about how we can mitigate, how we can eliminate things that can occur in their birth experience that might prove to have unexpected birth outcomes that were preventable. So just thinking about that as a doula, we want to make sure that we are empowering expectant parents to speak up if there is a concern. Okay, so Count the Kicks, and I know most of you are familiar with this, but why does movement matter? Why are we so focused on fetal movement monitoring? Well, there's 2 really important points for this. This is the way that baby communicates before birth. This is the way that baby lets us know, hey, something's not going right, or hey, I'm healthy and happy. So this is an early sign, and sometimes the only warning sign that baby may give when they're out of distress. So think about when you might be sick, when you might have a cold or the flu, and you don't want to move. Babies are the same way. So they are preserving their energy for those vital functions in their body. Then that's what we know physiologically is occurring. So they are self-protecting. And so if we are monitoring, if an expectant parent is monitoring movement, they're going to be much more aware of changes in pattern, and they can detect those warning signs. So what are things, what movements count? Basically everything but hiccups. And the reason for that is that a hiccup is an involuntary movement. We have no control over when we hiccup, how we hiccup, how long we hiccup. And so everything else, the rolls, the kicks, the jabs, count. And an expectant parent will start recognizing patterns of movement around 28 weeks that are, they might notice that movement well before that, but patterns of movement to be able to say, my baby kicks a lot after breakfast, that's usually a recognition that's going to come in that 3rd trimester. So ACOG, the American College of Obstetrics and Gynecology, has recommended that fetal movement monitoring begin at 28 weeks of gestation. So this is, again, that consistent pattern mom can feel and track. So how can you teach this to your clients, and what are kind of the basics? So this is a handy little tool that we have used, and we are happy to share this with you guys. Let me take a drink real quick. You can hear the vocal fry in my voice. I've been doing a lot of presentations lately, which is good news. So again, we're going to start in the 3rd trimester. And we want to encourage every expectant parent to count for every pregnancy. So, whether it's the first pregnancy, the fourth pregnancy, the sixth pregnancy, every baby's movement is different. Every baby's pattern is different. So, we really want to encourage that expectant parent to get in there to count those movements for every baby. So, monitor the movements. They can download the app or they can register and use a web counter. And just as a little note, if you're not familiar, the app is available in 21 languages. We have paper kit counting charts available in 13 languages, and we are adding them. We're adding more languages. So my goal as the director is to get us to the point where everything is offered in all of the languages that are on our app. So check in if your client speaks a different language. Let us know if you have a request for a language that you're not seeing as well, and that way I can prioritize it. So going back to this movement, count your baby's movement every day. So we're looking for the same time every day. So again, going back to what I said about establishing movement, if an expectant parent knows my baby kicks a ton after breakfast, or my baby kicks the most when I'm laying down to go to sleep at night, then that's the time of day that we want to hone in on, that we want to encourage expectant parents to count. So we're going to, again, pick a time when that baby is normally active. So focus on the counting time, how long it takes your baby to get to 10 movements, and then rate the strength of the baby's movement. So this is all using the app or the paper kit counting charts or on the web counter. Again, that app is free. All of the resources that we're offering are free to you. And so hopefully that's eliminating a barrier that might be there. So if someone's using the app, and I'll show a picture of that here in just a second, they also will be prompted to rate the strength of the baby's movements. And we also know from research that that's really an important an important aspect of fetal movement monitoring to include. So after the kit counting sessions have been going for a couple days, the expectant parent's going to see an average length of time it takes them to get to 10 movements. And just to be aware that there are some myths about this. When I went to nursing school way back in the late 90s, we were told that you were supposed to get 10 kicks in 2 hours. Well, again, every baby's pattern is different. Every pregnancy is different. And so research is now actually focused on establishing what is normal for that expectant parent, what is normal for that baby, and then keeping track through those monitoring devices. So again, after a few days of this normal counting at the same time, they're going to see a pattern. If they're using the app, they're actually going to see, and I'll just show you a picture of this. This is what the app looks like. And I would encourage you guys, I'm talking, to download it and kind of play around with it if you've never looked at it. So when someone is counting, they're going to put their finger on that little footprint, and that every time they feel a movement happen, that timer will stop once that circle is completed with 10 movements. And so you can see in the second phone, that is the graph that is generated when someone is a registered app user, and tells them over this session of counting, so however many sessions they've done, it'll show them this kind of average. That's a really powerful tool. When somebody is experiencing a change in their pattern, they're concerned, they go to OB triage and they share this kind of data with them. That's a really powerful tool. So again, going back to that empowerment aspect, that's what we want to have happen. We want people to be empowered to use the app. So expectant moms, they get to know what's normal for her. They get to know what's normal for their baby, and they know when something is off. So we want to trust intuition from these expectant parents. And that fifth point today is call providers right away if they notice a change in strength of movement or how long it takes the baby to get to 10 movements. So we want expectant parents to reach out right away. If their intuition is telling them, I need to get into the hospital, then go to OB triage right away. But we just want to encourage our clients to get in contact with their provider if they're noticing a change in movement. And so that is the message. These are the steps, and that is the message that we have. It's really easy to do. And again, thinking about ways that you can encourage your clients to do this. If they have time to drink water, maybe that's the point where we want them to combine that behavior with the fetal movement monitoring. So you're sitting down, you're going to make sure you get 8 ounces of water in this time that you're counting. It's really important to hydrate during pregnancy. And so, this is a time where somebody could be mindful. They're checking in. They might be doing, some kind of relaxation technique, but use Count the Kicks as a time for self-care, self-reflection. So sit down, encourage parents to sit down, lay in a comfy spot, think about how they're feeling, check in with themselves, drink that water, relax, and conduct that kick counting while they're doing that. It only takes a few minutes to conduct these sessions and to kind of have that intuition. So really, we're encouraging this to just become a normal part of practice during the third trimester. So let me share this video with you. Uh-oh, my link is gone. Oh, darn it. Okay, we're going to pivot. I will not share this link with you at the moment, but I will send this link out so you can see it. So essentially, this is a PSA. It's a multilingual PSA that you're able to share with your clients. I'll get that linked up here as I give you an opportunity to take a look at materials today. But let me keep going. So this is a picture of the web-based counting platform. And this is an opportunity for folks who might not have an app. Maybe they're sharing a phone. Maybe they don't have access to it through their work. Someone could use this web-based platform. And again, they can just log on. They can change the language there. This could be something that's easy to do at a library. We have a lot of folks that engage with us that their patients, their clients are using computers at the library. So this is a great opportunity. In the app, someone will notice, and let me go back here for a second. So this is, again, the app platform. And within the app, there's a little hamburger menu up there in the upper left, and it's probably really difficult for you to see right now. But if someone were to click on that, and just to make sure everyone is aware of this, this is an opportunity that we have to link people to local resources by zip code. So what we talk about sometimes is social determinants or social drivers of health. And this is an opportunity for individuals to make a connection to what they need. And so we are combining this platform with Find Help, which already has preloaded resources available by zip codes. But then we work with the Florida Department of Health and some of insurance companies in Florida, some community organizations to add things that are specific to Florida by zip code. So if someone is looking for oral health care, they need a dentist, they have something going on, they can search for dentists in the area. If someone is experiencing food insecurity, they can go and find food pantries that are local to them. So this is a really great resource for your clients. Maybe they need help with Section 8 housing. Maybe they want to find a local doula. Again, this is a really great resource to lean into, and you can use this as a doula. You can use this from the app for yourself. If you're talking to someone in the community, you can look up these resources and see what is needed. So let me pause there and see if are there any questions that I can answer in the chat. I'll just give it a second here to see if anyone has any questions. Okay. All right. So let me keep plugging away then. I'm gonna let me stop sharing my screen for a second and just see if I can link back that video for you really quickly. I just really want you guys to see that one today. Sorry about this. Okay, so let me talk about common misconceptions that you might come across in education with clients. So, a lot of what we do within Count the Kicks is to educate parents on misconceptions, such as the one that I show you right here. So, this first one, I kind of already addressed that, but sometimes providers will say that a baby should kick 10 times in 2 hours. And the trouble with this is it can cause delays in care for babies whose normal is to kick faster. So say you have a baby whose normal is to kick 10 times in 5 minutes, and suddenly it's taking them an hour and a half. That's a huge difference that should be investigated, but it's still under that kind of 2 hour mark. And again, that's an outdated metric, but still very present in the medical world. So again, combating some of these misconceptions. We find that it's when we look at research, when we listen to the stories of expectant parents who did have what we would call a near miss, they often they speak to their baby's normal pattern and that there was something wrong with it. And you can see our baby safe stories from our website over and over and over. We hear about this intuition that there was a difference in the normal movement pattern. So that is why we want to combat this misconception. So another misconception that we see is, with our age of technology, Doppler devices are getting really popular among patients. But unfortunately, for an average parent, it can be difficult to be sure that they're picking up their baby's heart rate and not their own. And Amazon Dopplers are not quite the same quality as someone's in a doctor's office. So if a baby's heart rate is gone, they may not pick this up. It's much more difficult to intervene in comparison to baby's movement, which gives some time to get to the doctor for an intervention. And there's some great information that I'll share an additional resource with you. Baby nurse Jen Hamilton has put out a great video where she shows that, she shows a fetal monitoring strip and it's 3 babies and they all have a heart rate of 140, but their reaction time is vastly different when you look at their movements on the strip. And so it's very important that we tell our clients that they should not be acting, in a medical intervention way for themselves, and to allow providers to gather that information. So just really kind of want to steer away from the Doppler devices because they may not paint an accurate picture. So, in combating misconceptions, I've talked about research, and let me share a little bit of research about our campaign as well, so that we really are founded in research and we're evidence based. So, this is what's called the Norway study. Our work is driven by this research, and we continue to be driven by this research and others in order to make an impact and to speak to those partnerships that we have. So I want to make sure that I share not too much, but just a little bit about this study. Our founders at Healthy Birthday attended a stillbirth conference and learned about the Norway study. And you can see some of the highlights here. But in Norway, what research have found is that they educated expectant parents about fetal movement monitoring. They found that they could decrease the stillbirth rate in their country by 30%. So there's all the study lays it out for you, and exactly what they did over a period of time with an adequate study population. And so our founders took this and they decided that they wanted to try this in Iowa. And we have seen a 30% reduction in our stillbirth rate over time as well. We have additional research that we share. We've been published in the American Journal of Obstetrics and Gynecology and the British Journal of Obstetrics and Gynecology, showing that decline that we've had in Iowa. So as our program has progressed, we have had these studies that back up the efficacy of our work. And this is important because a lot of providers look to the sources like these to decide how they're going to implement a program. And largely pregnant people identify with their medical providers as their main source of health information. So we want to continue to get information out like this. And here is just a visual for you. If you're looking at the decline of Iowa's stillbirth rate what you see, that red trend line, or I'm sorry, it's not a trend line, the red line of the graph at the top, that's the United States stillbirth rate, overall stillbirth rate. And then those blue kind of tealish dots with a trend line that goes down through it. This is actually a graph from one of the research studies, but you can see that we are trending in a downward pattern. So it's really important to look at longitudinal data for this. So you do see some spikes in the road that are a little bit different. And what we know about that is in Iowa, in the public health, we can correlate that to things like syphilis outbreaks, COVID-19 pandemics, different public health issues that were happening, and also different variances in the birth rate. And so just to give this overview, again, we're not here to get into weeds of research. I just want to highlight that we are taking a look at evidence, and we are trying to understand how we can do more and share more. So we know that midwives, doulas, mobile clinics, all a really important part of the healthcare team. And so we are trying to expand our reach beyond traditional providers like physicians. And we're partnering in unique ways in communities like the mobile health clinics, and also partnering on opportunities like our fetal movement monitoring wristbands. So they kind of look like, this is not one of them, but they kind of look like an Apple Watch. There is a slider that goes across the bracelet. The bracelet is numbered 1 through 10. And this is an opportunity that we can give to folks who may not have technology to use for fetal movement monitoring, or maybe they want a reminder. These wristbands have become very popular. We're seeing them more and more in non-traditional provider practices as an opportunity for particularly BIPOC populations. So really want to make sure that we're paying attention to the folks that are using our programming as boots on the ground, and I just want to honor them today. So another highlight of research, and this speaks to, again, coming out of what doulas can do to be a part of this. So encouraging awareness of fetal movement monitoring may be associated with reducing adverse neonatal outcomes and without increase in interventions in labor. So that's a huge part of the role of a doula is, decreasing the need for intervention. So really serving as someone who is going to help advocate for those expectant parents to get what they want out of their birth. And what we all want is for a healthy mom and a healthy baby at the end of that delivery. So really important. People wonder if they're using the app, are we going to send people to the hospitals more frequently? Evidence shows that that is not the case. Parents tend to feel like their intuition is being backed up by the data that they get from the app. And so they can also bond with their baby in a little bit more concrete way. And so these are all additional benefits that we see. Here's again some studies. If you're looking for numbers, that we, again, no increase in anxiety among pregnant people. Our app users, we survey them once a year. It's totally voluntary. If I didn't say it already, let me say it again. App is free. The app is free. There are no ads. We are not collecting information and selling that to outside parties. We do ask our app users at the end of their pregnancy if they want to participate in an end of pregnancy survey, and this is where we get a lot of this data. So 77% of our app users reported feeling less anxious about their pregnancy because they were using the app, because they were monitoring fetal movement monitoring. So more evidence that fetal movement monitoring is really important. If you've heard of the Hear Her campaign, this is really important. This is coming out of the CDC, and baby's movement is highlighted as a warning sign. So this campaign is widely recognized. Want to make sure that we're recognizing maternal early warning signs that something is wrong. And so baby's movement is one of those signs. So you can speak to kind of the research and the reach also. Okay, so I want to talk about, let me go to this slide here. We want to talk about free educational materials. So thank you to the Florida Department of Health for providing our partnership that allows us to get educational materials in the hands of expectant parents. So this is where you have an opportunity today. Let me just put a link in the chat here for you. You have an opportunity today to order free materials if you don't have them. Some of you, I recognize your name, so I know some of you have had our materials in your practices, in your facilities and your practices. So you're talking to clients about this, but want to make sure that we highlight that our materials are available in 4 languages in the state of Florida. They're completely free, no shipping, nothing. If you go to this link, you can see what's available. We have a lot of different options to not only interact with expectant parents, but to also get the word out. So things like badge reels or pens might be something that you want in your practice to encourage and remind folks to count the kicks. So the link is in the chat. You can just go to countthekicks.org and select Florida. But I will give you a couple minutes to make some orders. I'll actually stop us here for a second and give you a second to go in there. I said a second, give you a minute. So on this screen here, I've got an example of our traditional materials and our at-a-glance materials. So the traditional materials, they're great, they're wonderful, they're very picture, or you got the Dr. Seuss style kind of there, very very colorful. We're known for kind of that yellow color and these materials. Some folks find that the at-a-glance materials are a little bit better for clients because they are more condensed. They're also what we call picture-based, so addressing health literacy. Again, either of these options is available in all 4 languages in Florida, so English, Spanish, Portuguese, and Haitian Creole. So want to make sure that if you also have questions about our materials, feel free to email us. If you have suggestions about our materials, feel free to let us know. So we're coming around the corner here. I just want to provide some additional resources to you, and then I would be happy to answer questions and interact with you a little bit here for this webinar today. So let's talk about systems change and how this can work. Again, I want to reiterate that hours, minutes matter in the work that we do. So doulas are amazing at helping their clients advocate. You can be a huge advocate by just affirming your clients' concerns and encouraging them to seek medical attention if something seems off, or even speaking up for your client if they're not in a position to do so. So here are some things that we think systemically could be things that could be implemented in your program. So debunk those misconceptions and encourage people to speak up. Have all the doulas, if you're in a practice by yourself, then you got this, But if you're in a practice that's a collaborative or staff trained through an agency, make sure all of the doulas and the staff are trained in Count the Kicks. Make sure they understand fetal movement monitoring importance. We are, I see we have some healthy families here today. We do a lot of presentations. Contact us if you have an opportunity for us to reach doulas and answer questions. It doesn't have to be a webinar like this. It can be come and answer questions for 10 minutes. We also have other opportunities like virtual baby showers. We just did one in Haitian Creole last week. And so watch for those opportunities and engage with us and increase the training that's available inside of your facility. If you have a family care or intake form, you can include Count the Kicks education on that. You can even put a little QR code with our app. So absolutely include information. That's, those brochures, those app cards, any way that you can get that messaging to expectant parents. So something to think about is the opportunity to learn how to do kick counting, to learn, more about using the app. So the glucose test, that's a great opportunity when somebody's sitting around they've had to drink that nice, yummy glucola. Check in with them before and after the test and let them know, hey, if you haven't downloaded the app, let's download the app and let's talk about that. See if you have any questions, practice with it, play with it. It's also a great opportunity that you could share a video with them about Count the Kicks. So when I send you the recording, I'll send you a PSA that's embedded. You're welcome to share that. We have lots of resources on YouTube. And so all of this education is available to you. So again, add those Count the Kicks brochures to new client packets. Any kind of email that you're doing, you can put a little tagline, you can put a link to download the app. That app, again, is free, available through Apple platforms. The Google Play Store platforms we've had down the Apple Watch monitoring, and actually that's coming back. It's coming back. We've finally been able to work out some of those bugs. So just encourage people to count in a way that's meaningful for them. And then finally, add Count the Kicks education in your childbirth education plans. I've been doing the series with Nikia Lawson. I've been participating in that. It's great opportunity to talk about Count the Kicks in the childbirth education and to answer questions and to alleviate concerns. So we do have downloadable lesson plans that are free on our website. We're happy to share that information. And as always, I will take that feedback. So if you have questions or concerns or suggestions for our materials, happy to take that. So we offer a CE training. So if you're interested, like I said, I was high level today, didn't really get into the weeds of research, but our continuing education training has just been updated. Megan, our program director, has updated this. So you can get as far in as you want about this. This is a very low cost opportunity. It's $40 for those CEs. They're widely recognized. We do have partnerships with DONA to provide education. And so this is a great opportunity for you to learn a little bit more, do some training on your own. So this is the link I'll also share with you after our webinar today. Our Count the Kicks ambassadors are another great resource. So I know, again, we have some healthy families here. We've been able to have our ambassadors attend some of the community baby showers that are out there. This is one of our wonderful ambassadors, Takesha from Indiana. And she is always in the community, always sharing information and engaging with parents. And so we do have Florida specific ambassadors that are very busy and utilize them. They want to be used. They want to get the message out. And they can attend a variety of events. So even if it's something like we have volunteers going to farmers market and tabling there, let us know about the opportunities so that we can see if we have a fit for that location. So just as we're going out today, I just want to share another Baby Safe story. So this is Piper, and Kendra, Piper's mom, used the Count the Kicks app in a high-risk pregnancy with placenta previa and partial abruption after a previous loss. At 27 weeks, Piper's movements became slower and different, so her mom checked in with her obstetrician. After a non-stress test and a BPP, heart decelerations were becoming a concern. And so Piper was delivered by C-section at 28 weeks. Once Piper was born, it was found that her placenta was about to have a full abruption, and Piper had not been getting the oxygen or nutrients that she needed. So again, the only warning sign here was that there was a change in movement and mom's intuition. They were trusting in mom's intuition. So we know that there are other stories like this out there. We have Florida Baby Saves that are similar stories. We're just hoping that through Count the Kicks education, working with you as doulas today, we can have more baby saves. We can have more opportunities to save the life of an expectant parent, to save the life of babies. So we want to get this tool into the hands of those who will use it. So I encourage you to follow us on social media. If you're not currently following us, these are the platforms that we share. Would love to get some engagement with you. So Healthy Birthday is a little more focused on advocacy. Right now we have federal legislation pending. It's going to get voted on this week, the Maternal Health and Stillbirth Protection Act. And so that is an opportunity that you will have to hear more about the advocacy, to hear what's going on in your state. And then the Count the Kicks channel, this is a little more expectant parent focused. So there's a lot of tips and tricks and comments we take comments from folks. We tell our baby save stories here on this channel. So really expectant parent education focused. And then there's a QR code that'll be coming to you if you want to stay up to date with our monthly newsletter and just learn about opportunities. Florida has been a great partner for us. We are constantly introducing new materials into the state. The addition of Haitian Creole last year. We're looking at languages to offer. Florida is very invested, and we are very grateful to have an opportunity to work with providers and expectant parents in the state of Florida. So congrats on that. So that's what I have for you today. I would love to take any questions that you have and see if there are suggestions or things that I can answer from you. I will stop sharing and I will come off recording.